It's all yours.
All right. Good morning, everyone. Thank you so much for joining. It's a really big group this morning, which I'm excited about. So just some background about me. I'm a social worker. I've been in the DMV area for about 7 years now, originally from upstate New York, went to college in Boston. So this snow feels like nothing to me, honestly. I've been missing the snow. Um, I have been working with older adults for a really long time, but actually came into this field in kind of a funny way. I was originally doing violence prevention work professionally and then volunteering in hospitals and hospice and nursing homes, and really, really loved that work, but was working in the domestic violence field professionally. Worked in that field for quite a while. And then I started working at the Elder Safe Center, which I actually presented to you all back in 2020 when I worked there. So that is a shelter program for older adults that have experienced elder abuse. And it's located up in Rockville, Maryland. Loved that work. And now I've been working with older adults living with dementia and supporting their caregivers. So I'm going to go ahead and share my screen, tell you a little bit more about the RAFT program, which Cheryl started to talk about, and I'll explain it a bit more. So the RAFT program, we are a regional program, so we actually serve all of Northern Virginia. The original program is the Facility Mental Health Support Team, which is supporting older adults with serious mental illness and or dementia with very challenging behaviors, help discharge from the state psychiatric hospital into partner nursing homes and assisted livings in the area. That program continues on, but we're really excited. In the past year, we started the Dementia Support Program, which is serving older adults in the community. And I was brought on a couple of months before the program started to help build it and launch it. This is a short-term program, about 2 to 3 months, that will work with families, and it's all free. We're supporting individuals living with dementia and their caregivers. So a lot of caregivers, they get this diagnosis of dementia and they don't always know what it means or what the next steps are, how they're going to be, as a family now that they have this diagnosis, or maybe they as a caregiver have their own health issues, and what is this all going to look like? So we can help provide specialized education and training to those caregivers of how to best support their loved one and how to best support themselves and help connect them to resources. So our trained dementia specialists will work with families. They'll come right out to the home, meet with them about once a week. Sometimes it's a little bit less, just depending on the needs of the family. They'll help identify what are the challenges in the home, what are the areas of concern, and sometimes people are coming to us with pretty big challenges. Their loved one might be really aggressive or have really extreme agitation, or they're wandering every single night. Sometimes the challenges aren't so big, and that's okay. They're just saying, hey, we got this diagnosis. We don't know what it means. We don't know what services are out there. Just give us whatever information you have to share. And that's also fine. So our team provides really individualized education and training. We'll help connect to resources and services. And we have a big focus on non-pharmacological interventions. So anything that is not focused on medication. So how can we help relieve some of those symptoms, relieve some of the challenges in a non-pharmacological way? This is the eligibility for this program. So a resident of Northern Virginia, 55 years and older, either a diagnosis of dementia or some symptoms of dementia. So some folks are coming to us and they don't have that diagnosis yet. That's okay. We can work with them for up to 60 days without the diagnosis. And they do need to be living in the community. So this does not include nursing homes or assisted livings. These are folks that are still, in their own home of a caregiver, family member, an apartment, just not in that facility type setting. And anyone can make a referral to the program. We have an online form that folks can fill out, or if for whatever reason that form is not accessible, you can go ahead and email or call me directly and we can go through that process. So if you have any questions about this program, please feel free to put them in the chat. I'm happy to answer them. Otherwise, I'm going to go ahead and start our program today about mental health. So what is mental health? I think it's a term that we throw out there a lot, and it includes a lot of different things. So it's our emotional, psychological, and social well-being. And I think sometimes we equate mental health with mental illness when they're really not the same thing. All of us have mental health, just like all of us have physical health. Whether that mental health is good or bad or we're struggling with it is another question, but we all have mental health. And our mental health affects how we feel about the world and people around us, our ways of thinking, it actually affects our behavior and our relationships, how we manage stress, and our stress also affects our mental health. And it also really affects our physical health and vice versa. We're going to talk a little bit about that when we get into the specifics. So just an example here of how all of this is so interrelated. So how we feel, so maybe feelings of stress, really influence how we act, right? Maybe we're stressed, we start to get a little irritable with the people that we love. We're not really having very great relationships because of that stress. Maybe we're snapping at others. Maybe we're drinking a little bit more than we normally would. Maybe we're stopping at McDonald's or eating some unhealthy things to deal with that stress, and that's our way of coping. And then that starts to affect our body, right? We start having weight gain. We start sleeping poorly, having high blood pressure. Our body starts getting actually affected by this stress, which again will then lead to maybe I start to feel more stressed because now I've got more health problems. Now I'm starting to feel kind of worse about myself because of these challenges, and it becomes really cyclical. So how we feel and our mental health really affects everything about us, including our physical health. All right, so this is where I'm going to make you all be a little interactive. Feel free to put it in the chat of what are some of the common stressors in your life. You don't need to be too specific, kind of just broad strokes. Okay, caregiving is one example, and that can be extremely stressful. Anything else? Isolation. Yeah, that's worse in the winter, I'm sure. Home maintenance. Oh, yes, I just bought my first house this spring. It's a pain in the butt. Illness and a partner. Driving. Yeah, driving traffic in this area for sure. All right, keep putting them in there. Icy sidewalks. Yeah, that's like a really big concern, and that can contribute to further isolation if you're feeling like you can't get out there. The unexpected. I agree. Changes and not knowing what's coming next can be really hard. 2024 elections. My workplace is crazy computer system. Technology can be really stressful. This is great. You guys are hitting on a lot. Verizon. Physical decline. Yeah, our health problems, or even just anticipating what those might be and how to plan for it can all be very stressful. Some of the ones that I had on here that are some common stressors for folks could be finances, planning for the future, planning for right now can be difficult. I think my computer's not popping up. There we go. Our healthcare, our health of loved ones, which also came up. Grief and loss, whether that's grief and loss of a loved one, it could be a pet, it could be maybe your job was a really, really important part of who you are and how you saw yourself and how you spent your day. And now, after retirement, you're really feeling that loss. The future, and I think someone talked about that, can be really, really stressful. And our relationships, good or bad, our relationships often can cause us stress. Maybe it's that we don't see folks enough. Maybe there's some relationship challenges there. Maybe it's the lack of relationships, or romantic relationships in our lives that causes us some stress. But managing stress and knowing how to manage stress is a really big part of managing our mental health, because long-term stress can really, really increase our risk, for mental health challenges. So, one important part about managing your stress is knowing how you physically experience stress. Sometimes we ignore those signs, our stress kind of builds up and continues. Our body sends us a lot of signals, and those signals are different, for everybody. So, feel free to put in the chat if you want to share the ways in which you experience stress. But for some of us, it might be stomach issues. I know for me, when I am stressed, I can't eat a thing. I have absolutely no appetite. And for other people, it's the opposite. You might want to eat everything, everything there is when you're stressed. Some of us get really irritable and kind of cranky and not so great to be around. We're kind of snapping at other people, having a little bit more conflict. Some of us cry, maybe get really easily overwhelmed. Small things go wrong in life and we are just falling apart because of how stressed we are. Might have an excess of tiredness, feeling like the day is just so hard. I just want to sleep all the time, or I just feel so tired because of everything that's going on. Even if I'm getting 8 hours of sleep at night, I'm just feeling so tired. Or being totally unable to sleep. So maybe I'm so tired, but I'm up all night, stressed. Some of us also hold our stress in our muscles. It's really kind of goes back to our body's fight or flight response, which is really what all of this comes back to. Our body responds to stresses pretty much all the same way. So whether we're, a caveman with a cougar about to attack us, or we're experiencing the traffic of the DMV, our body sends those same fight or flight signals. And sometimes we're able to turn them off if we can manage our stress well. And sometimes, if they're very long term, we can't. And that's when those things start to really build up. Because when those fight or flight signals are going off, it affects our heart rate. It affects how our breathing is. It affects our muscle tension, which all works really well and makes a lot of sense when we're trying to fight that cougar. But doesn't make so much sense when we're dealing with a sick spouse. All of those body signals are just making things a lot worse. So making sure you're checking in with how you experience stress and knowing those signs for yourself and for your loved ones. I think that's also really helpful to know so you can check in with them. All right. So thinking about mental health issues for older adults, approximately 25% of older adults will experience some type of mental health challenge. And I honestly think that number is a little low. I think it's probably pretty underreported, and we're probably seeing much higher numbers than that. Some of the most common issues, the ones that we're going to talk about today, are anxiety, depression, and substance use. Those are the most common for older adults. So we'll start off talking about depression. So first off, depression is not a normal part of getting older. And I think this is a really common misperception or misconception that feelings of sadness, overwhelming sadness, are just a normal part of the aging process. And that is absolutely not true. I think that there are personal things that can be going on. There are community level things that can be going on that contribute to higher risks for older adults. And we'll talk about them, but it is absolutely not a normal part. It's something that can be treated. It's something that we should check in with and look into. And it's also not a moral flaw or a weakness, right? It's a medical issue that's been going on with this person interfering with their normal function. An estimated 1 to 5 older adults will experience clinical depression. Many more will experience symptoms of depression. And the number rises to about 13.5% for those who require home health care or have been hospitalized. So 13.5% of those folks are also experiencing depression. So some risk factors, things that can cause depression: loneliness and isolation. And I know that came up when we talked about what are some of the stresses in our lives. Feeling lonely, not having that close support system, feeling isolated in our communities can really contribute to depression, which is one of the reasons it's so wonderful you guys have the village and you have so many different things going on, so many different ways to connect with folks. Grief and loss can contribute to your risk for depression. Folks, whether they've lost a loved one, as I said, a pet, or even just kind of their loss of identity through, retirement or changes in their lives. It could be loss of independence. So maybe you're kind of transitioning from living on your own to living with a child, an adult child, or living in, a senior community or an assisted living, or just are starting to need more help with things. Maybe driving is a little bit harder, getting around is a little bit harder. And all of that loss can contribute to feelings of depression. Chronic illness and pain, and a family history of depression. And I share these risk factors not so you can look at them and think, oh my gosh, I've got, 4 out of 5. I'm really at risk and get all worried, but more to think, okay, I do have a lot of these risk factors. I need to take a little bit extra care with my mental health and check in with myself. Or say, oh wow, my sister is going through a bunch of these right now. I should make sure to check in with her a little bit extra. So knowing your risk and knowing the risk of those that you love is really important. So depression is actually very often overlooked for older adults. Does anyone know why that might be? Feel free to put in the chat why you think depression is often so underdiagnosed in older adults. I'm going to use this as a chance to take a sip of water while you type. Any ideas? So hard on Zoom because you can't tell if people are trying to type and they're just taking a second or if it's silence. Yeah, so if folks are no longer interacting with others, they're so isolated, that definitely can cause it to be overlooked. Yeah, so someone says it's considered inevitable for older adults. And some folks are worried that they might end up in a facility if they mention it. That's very true. It's a very big fear for folks. They might live alone. A lot of answers about isolation. They don't know how to get help or what can help. Yeah, all of those are really, really good answers. Yeah, that's very true. Medication side effects can also look like depression sometimes and cause depression. So some other reasons are the symptoms of depression for older adults isn't always the classic symptoms for depression. So sadness, feelings of sadness, isn't always what people are expressing right up front. And we'll talk more about what those symptoms can look like. And there's also a lot of stigma around mental health. So, folks don't know where to go for help. They don't necessarily know how to talk about what's going on. And they might be kind of concerned about going to a mental health professional compared to their primary care doctor. And primary care doctors often underdiagnose depression, especially in older adults. So, some symptoms of depression, specifically for older adults, I think, well, a lot of times when we think about depression, we think of like this Eeyore image, right? It's kind of the sadness, blue, a little rain cloud over his head. And sometimes it can look like that, those feelings of hopelessness, being really pessimistic. But sometimes it can look really different. It can look like folks who are just really irritable and cranky and not so great to be around, right? The people that are seem like they're just pushing everybody away. It could be, withdrawing from activities or hobbies, having trouble concentrating and making decisions, and memory loss can be a symptom of depression, which, of course, with older adults, then gets misdiagnosed as the beginnings of dementia. It can be feeling incredibly tired and lacking energy, or feeling like you can't sleep. And sometimes those feelings of tiredness or lack of sleep are also things that we think, oh, that's normal as you get older. Changes in appetite, and also pains. Physical pains is a big way that people will talk about their depression. I have persistent stomach ache. My bones are always hurting, and they talk about it more in this physical way than in the emotional way. Some of which because, our emotions really are stored in our bodies, but also because that's a little easier. It feels less stigmatizing to say, I have a constant headache, then I feel really sad all the time. And then thoughts of suicide and self-harm can also be pretty serious symptoms of depression. So, some of the risks of depression, what can happen with long-term depression or even short-term depression, really? Increased risk for cognitive impairments. So, individuals with depression have a higher risk of dementia and vice versa. Social isolation, which then, of course, comes with a whole host of other issues when you're socially isolated. Pre-existing medical conditions will often get worse. People have a harder time with recovery from illness. When they're feeling depressed, they're less likely to follow up on doctor's appointments, and they're less likely to get well, really. They also have higher healthcare costs. And I would be remiss if I didn't mention suicide. Depression is a significant risk factor for suicide, and older adults make up a disproportionate number of suicide deaths in the United States. So, older adults make up 13% of the US population, but 20% of all deaths by suicide. And white men over the age of 85 actually have the highest risk of suicide, with 6 times the national average. So, checking in for folks when they are experiencing those symptoms and getting help and treatment is so, so important. So, treatment for depression can be going to your primary care doctor, and that's sometimes a good place to start. But as I said, sometimes they're not diagnosing this. So, talking to a mental health professional is also really, really important. And there's no, one size fits all treatment for depression, but more than 80% of people with depression can get effective treatment through a combination of maybe medication, psychotherapy, other self-care techniques. And there's also a lot of support groups out there. And we are really lucky to be in an area of the US where virtually or in person, there are just a ton of support groups. And some of them are very, very specific. Especially when we start looking about loss, support groups for spouses where the spouse is sick, spouses who have lost a spouse, about people who have lost a mother, who have lost a father. There's just a lot out there. So please, if that's something you're interested in, definitely look into it. All right, we're going to switch gears a little bit now, talk about anxiety. So anxiety is really a continuum. We all experience a little bit of anxiety sometimes in our lives. When we're maybe for some of us when we're giving a presentation or when we're sitting in traffic or we think, oh my gosh, I'm going to be late for that meeting. And that is normal. It's generally not really disrupting our lives too much. But kind of at the further end of the spectrum, when we have anxiety, that's really debilitating and is affecting our everyday lives. About 3 to 14% of older adults have diagnosed anxiety disorder, and many more will experience symptoms of anxiety. So, there's a couple different types of anxiety, and I'm not going to spend too much time on these, but just so you know, there's a couple forms. So, panic disorder. This is when folks will experience panic attacks or sudden feelings of terror. And they seem to strike with actually no warning or no apparent reason. Obsessive compulsive disorder, where folks experience recurring unwanted thoughts or actions. So they might feel like they need to wash their hands excessively to get rid of germs. That's something we saw sometimes during COVID. Post-traumatic stress disorder. This is anxiety caused by a traumatic event. So it could be experiencing abuse, a natural disaster, or some other trauma that threatened the person's safety. A phobia. So this is when you have extreme disabling fear of something that actually doesn't pose a significant threat. So it could be extreme fear of, I heard of someone once, she had an actual phobia of squirrels, which was affecting her daily life and going out and going for walks, but we really didn't pose any threat to her actually. And then finally, the most common is generalized anxiety disorder. So this is chronic worry about everyday routine life activities and kind of always anticipating the worst and having it really affect your daily life and functioning. So, some risk factors for experiencing anxiety. Certain medical conditions can actually up your risk for anxiety. And a lot of these are ones that affect our breathing or affect your heart rate, because that feeling of your heart racing, feeling of like you can't breathe, can trigger anxiety. So, things like COPD, cardiovascular disease, are common risk factors for anxiety. Poor health, poor sleep, can increase your risk. Feeling or certain side effects of medications. And again, these are often ones that kind of bump up your heart rate, or are stimulants, can increase your risk. Misuse of alcohol or prescription medication can definitely increase your risk. Not being able to move around, so having a loss of mobility has been a known risk factor, and as well as stressful life events or negative events in your childhood. So some signs and symptoms of anxiety, to think about for yourself or folks in your life. These are, the uncontrollable feelings of fear or obsessive thoughts and behaviors. So you're not just a little bit worried about, that event next week. You can't sleep, you can't eat because you're worried about something that's going to happen. Feeling like you're always preparing for the worst. Like you can't get comfortable. You're so restless, you can't sleep. Maybe you're starting to avoid social situations because of how anxious that you feel. And then there's those physical symptoms. So, racing heart, feeling like you can't get a full breath. So, shallow breathing. Could be trembling or shaking. Hot flashes are a sign, or feeling very cold and not being able to get warm. Um, Frequently having to go to the bathroom, stomach issues, and poor sleep. And collecting items, feeling like it's hard to get rid of things can also be a sign of anxiety. So, our anxiety often comes from one of two parts of our brain. So, either the amygdala or the cortex. And I'm not a doctor, so I'm not going to get too much into this. But I do think it's interesting, especially if you are someone who's experiencing anxiety. The amygdala part of our brain is kind of the smoke detector. It's the part of our brain that doesn't have to think too much. It just has, oh my gosh, danger, danger, danger. It's the part of your brain that if, somebody jumps out at you before you even have to think about it, you kind of jump back and you get scared. Anxiety that's caused by our amygdala is often really hard to pinpoint. We might be, walking down the street or in the shower and see something or smell something or feel something, and suddenly we're really, really anxious. And that's because some part of our brain, our amygdala, has associated whatever that thing is with danger. And that's often related to something in your past. Anxiety caused by your cortex is more kind of that thinking anxiety. That's the anxiety caused by, okay, I think I locked my door. Did I lock my door? Okay, what would happen if I didn't lock my door? And suddenly we're spiraling. And before we know, we're experiencing those anxiety symptoms. But it's much more caused by our specific thoughts. So treatment for anxiety is really important. It often, unfortunately, goes untreated, similar to depression. It's important to figure out if the symptoms you're experiencing are anxiety or if they are a medication side effect or if they're related to a medical issue. What might be contributing to the anxiety? Is there something specific in your life that's causing it? But then similar to depression, medication, psychotherapy, and other self-help strategies can be really effective. And then lastly, substance use in older adults. I'm not going to spend too much time on this one just for the sake of time. But 1 million older adults have a substance abuse disorder. 65% of older adults report high risk drinking, really high number. And while I am by no means here to preach abstinence of alcohol, it is important to think about how our body metabolizes alcohol, which really changes as we age. So it can be harder to, break down alcohol to metabolize and different effects. So for people that never had any trouble, drinking a couple glasses of wine a night or, every once in a while, our bodies are going to be affected by it differently as we get older. So late in life, substance abuse that never showed up before is actually pretty common. And it's also really important to consider other medications you're taking and how those might interact with alcohol. All right. So when to get mental health support? Sometimes we think, I can do it on my own. I don't really need anybody. I'm struggling a little bit, but I don't need help. So these are some signs for you or for people in your life that it might be time to get help. Significant weight loss or gain due to those changes in your appetite. Feeling just really tired and worn down when there's no physical reason for it, but you're actually, avoiding responsibilities and things that you're supposed to do or things that you would have wanted to do because of how bad you feel and how tired you feel. Not finding the joy and comfort in the things that you once did. Feeling really overwhelmed or feeling like you're reacting disproportionately to events. Something small goes wrong and you blow up with anger or you blow up with sadness. Not taking care of your hygiene. So if you're noticing that, just getting up and washing your hair is feeling just too hard, or you just don't even care about it anymore, or keeping your home clean, just, who cares? And now it's been a couple weeks since you took out the garbage. Those are signs that it's time to get help. Drinking alcohol more than you usually would, or drinking in order to feel normal, to feel okay, to get through the day. Similar if you're using your prescription meds, not as directed. sleeping too much, you're unable to sleep at all, and having thoughts of wanting to hurt yourself or other people, definitely a sign to get some support. So what can that support look like? And we already talked about this a little bit, but it can be going to your primary care doctor, which could be a great way to start. A mental health professional, which could be a social worker, a psychiatrist, a psychologist. There's a lot of different options out there. Support groups, medications are a great option. I always personally think it's good to accompany medications, which another form of support. So whether it's talking to somebody, whether it's adding an exercise or yoga, but trying to get more to the root of the problem. Faith communities can be a great form of support. Friends and family and different forms of holistic medicine have had a lot of really great research to support how they help folks. So yoga therapy, music therapy, art therapy, acupuncture, massage therapy can all be really, really beneficial. Because as we talked about, a lot of the stress and a lot of these feelings are held in our bodies. So support that is focusing on the whole body is actually really beneficial. All right. So we're going to talk about self-care, but I'm going to start off asking you all, what do you do for self-care? Feel free to put it in the chat. What are some of the things that you do to try to take care of yourself? Oh, play my ukulele. That's really fun. Exercise. Hopefully go to the theater. Yeah, great. Connect with friends. So I'll let you keep putting that in there and I'm going to go forward. But I like the term self-care because I think it's important, but I also think we should never think of self-care as like a treat, an extra special thing that we're going to do for ourselves. Self-care needs to be a normal part of our lives. Caring for ourselves should be every day. It should not be because I deserve an extra little treat. So I think talking about it like that can be challenging. Oh, a lot of like singing and art examples here, walking, cooking, Tai Chi, meditation. It's awesome. So I like to think of self-care in two different buckets. There's those things that we need to do that bring us joy, that make us feel alive and energized and awake to the world. And then there's those things that we want to do that help bring us peace and healing and kind of bring down our energy. So we need kind of both sides. And that might look really, really different for all of us. I might say spending time in nature is what brings me that joy and makes me feel really alive. And for somebody else, spending time in nature is what helps bring them down and brings them that peace. So, it's really up to you kind of where you get each of them. But, some examples are going for walks, which somebody already said, dancing, singing was one of the big answers there, which was awesome. Swimming. I actually just started a water walking class in my community, which has been really fun. Spending time with loved ones, spending time with pets, cleaning or organizing your space can sometimes really help folks at feeling like the environment around me is clean and organized, which can help our thoughts. Taking a bath, reading a book, doing something creative is really, really great for your mental health, especially things that are repetitive actions. So if anyone crochets or trying to think of something else that's kind of repetitive like that, coloring can all help reduce anxiety. Somebody said volunteering. Yeah, giving back to your community is really, really important. Yoga and practicing mindfulness can all be really great forms of self-care. And then just some of the things that I think are in our everyday lives, like turning off our phones and our laptops and our TVs for a little while, not putting off sleep to get things done, getting a little bit of exercise, feeding our bodies good food and healthy food. Yeah, jigsaw puzzles, learning foreign language, taking courses online. All of those things are not just good for our mental health, but also really great for your cognitive health. So, kind of exercising your brain. Sleep is also really important for our mental health and our physical health. So, experts say older adults need an average of 7 to 8 hours of sleep a night. And I think sometimes there is this misconception that as we get older, we need less sleep, but that's really not true. Long term sleep or long term poor sleep can lead to dementia, depression, heart disease, obesity, diabetes, increased risk of falls, and actually cancer. So if you are having trouble with sleep, figuring out what the cause of that might be, whether it is related to stress, things in your environment, things in your physical health. It's really important to figure that out. Practicing gratitude is, I think, an awesome way to practice self care. So, even just focusing a little bit of time each day, whether it's in a journal or even just in your head while you're brushing your teeth, what are some of the things that you are grateful for? It's a nice way to start the day, a nice way to end the day. So sometimes our self-care strategies or our strategies for resilience are a little bit in how we think about things. So trying to avoid that black and white thinking. It's rarely all or nothing in our lives. So trying to avoid that. Putting things into perspective, focusing on what really is meaningful. Sometimes we get caught up in the, annoying minutia of life, and really putting things into a larger perspective, I think, can be really helpful. Remembering the power of negative thoughts. We hear our own voices in our brain more than we hear anybody else's. So if those thoughts are negative about the world and about ourselves, that's going to eventually start influencing us. So, changing your thought process to be more positive can be really beneficial. Um, this one is really hard for me personally, but accepting that changes are a part of life and that they're going to happen. And having realistic expectations for yourself and for others. I think a lot of times when we get caught in negative thought processes, it's a lot of shoulds. So I should be doing this. I should be able to do this. I shouldn't have a problem with this. I should be over this by now. But really, we're the only ones putting those expectations on ourselves. So giving ourselves a little bit more grace and giving the people in our lives a little bit more grace. And staying connected to your support system is so, so important for resilience and self-care. So how, as we end here, how to support someone that you are concerned about. So if you have somebody in your life who you're worried might be, struggling with their mental health, maybe you're not sure what's going on, just be there for them, offer emotional support, listening to them, caring for them. Sometimes tangible support can really, really help. Saying, "Hey, I I'm happy to take out your garbage, your trash on trash day, um, if you want." Just something really tangible can be helpful for folks if they're struggling, because it might be hard to ask for it. Being non-judgmental. If somebody's sharing with you some of the things that are going on, really putting that judgment aside. If they're saying, yeah, I've been feeling really, really, really down, and I actually haven't showered in a couple weeks because I've just been feeling so down, and meeting that with non-judgment. And sometimes just listening to folks. I think at least for me, especially like in the field I'm in, we hear people talk about their problems, and it can be so easy to just jump right in with, well, here's the ways you can solve them, and here's all my ideas of how to make that better. And that's often really not what people are looking for. And likely the ideas that you have of how to solve their problems right at the top of your head are things they probably already thought about. So sometimes just listening, validating, that sounds really hard. That would make me really frustrated too. I get it, is just really helpful for folks. Not
So,
criticizing.
just so you know, we're about 10 minutes to 11.
Perfect. I'm right on schedule. Thank you. Not criticizing folks or questioning them on their decisions, and then helping them stay connected to services. I think we're lucky in Arlington. There are a lot of services, but there's like a lot of services, but then sometimes still not enough, and it can be hard to get to them or feel the motivation to come to the activities or get to the activities, or get to those services. So help folks get connected and stay connected to support systems. So in addition, here are just some resources for you all. Senior adult mental health is through the county. So this offers counseling. There is what's called the Friendship Line. This is a national line specifically for older adults, and it helps prevent isolation and loneliness. So you can call that number 24/7, and it just provides somebody to talk to, somebody to chat with about a specific issue or no issue at all, just 2 in the morning and you can't sleep and you need somebody. NAMI, which is the National Association of Mental Illness, the Northern Virginia chapter, has a lot of education and resources and support, a lot of support groups. And then, of course, the RAFT program is here to provide support. All right, I'm going to stop my share and see if anybody had any questions about anything I talked about. So about the RAFT program and our services or any of the other topics.
We did have one that came up when you were talking about the RAFT program. Let's see if I can find it. Basically, this woman said she's got a friend whose husband has been suffering from dementia for years. She's been his primary caregiver. Now she's been diagnosed with dementia. What sort of help is available to her? And as her friend, what's the best way that she can help?
Yeah, that's a really hard situation because the caregiver is now also going to need help. There are some services. I'm assuming the person is in Arlington. I would make sure that they're connected to the Area Agency on Aging. So our Aging and Resource Disability Center has a lot of good resources and helping that family plan for the future, because if both folks have dementia, they're not going to be able to stay at home without some type of support for long. So whether that's family, whether that's getting in-home help, and that might depend on finances and what that looks like. So it could be private pay for in-home help, or it's possible to get Medicaid to pay for in-home help, but you have to qualify for Medicaid. So thinking of like the long-term plans for the family, I think is really important. And thinking of who are going to be the decision makers for that family. Because if the spouse now also has dementia, isn't going to be able to make decisions moving forward, maybe right now at the beginning of the illness, but eventually will not be able to make decisions for herself and for her husband. So getting a decision maker in place now is really important. And that's really for all of us. We never know what's going to happen. So getting a power of attorney in place of who do I actually want to help make decisions for me if I can't make those decisions anymore is really important.
Okay, and there's a follow-up. She said the person is in Montgomery County.
Oh, okay.
But
So yeah, Montgomery County. So Montgomery County also has aging and disabilities. So I would, again, connect with them. If it's a situation where, I don't know how far along it is, but if they're both very progressed and they really need help like right now, connecting them with the adult protective services could also be beneficial. Like if they're, she's got dementia, he's got dementia, no one's helping them. It's a situation where they're both really at risk and not safe, getting APS involved. But a lot of the other same things apply for Montgomery County.
what's the
I see a question about the current caseload of the RAF Dementia Support Program. So we can serve about 35 families at a time. And right now we don't have a wait list. So if you were to make a referral, you would hear from me. I would chat with you for a little bit, answer any questions you have, connect you with a dementia specialist, and they would set up a meeting in about a week or two. I would say the soonest I've seen meetings get planned for is the very next day. And sometimes it's a week or two out, just depending on everybody's schedules. And what do the activities look like? So the dementia specialist would come out to the home, and it really, really depends on the family, honestly, of what type of support. For some people, they have this dementia diagnosis and the family really doesn't know what it means. They think it's going to be cured. They think that um, like the person is just doing it on purpose, some of the things. So we might provide just like 101 education about dementia to that family. Sometimes we're focusing on a specific problem. So if somebody is wandering, we might help provide interventions like door alarms, tracking devices, exercise, all different interventions to stop wandering. If somebody is aggressive or gets agitated, helping the family learn skills to de-escalate that and how to better calm that person down and keep themselves safe as a caregiver. Sometimes it's helping people get connected with adult day programs, helping the person be okay going to an adult day program, getting them connected to home health, trying to think of some other examples because they're really kind of like runs the gambit of what folks are experiencing. Sometimes it's helping them get connected to activities. So, we had somebody, she used to love to paint. It was her way of relieving her stress, but then she had Parkinson's and she felt like she couldn't paint anymore. And our specialist helped her come up with an adaptive way to paint. And she was still able to get that kind of piece of herself. We've had folks who maybe it was, someone who was a homemaker. She loved to clean. She maybe not loved to clean, but it was what she did. She helped keep her house clean. And now she was a fall risk. So her husband was having her just sit, not he didn't want her to move because she was a fall risk, but she was still getting up and trying to do things. So we came up with how can she help around the house? What are activities that she can do that feel meaningful where she's also not at risk? And that, it was like folding laundry and simple activities we helped institute. Do you work with other agencies to support clients? Yeah, absolutely. So we'll work with aging networks. We refer folks to villages sometimes, to friendly visitor programs. We unfortunately work with adult protective services a lot for families, home health care agencies, hospice, mental health organizations. It's especially because we're a short-term program. We really want to build up their support network long-term. Well, I know we are right at 11, but thank you all so much. This was great. I appreciate how interactive you were on the chat, which isn't always easy to do. And it's a pretty chilly, miserable day out there. So thank you for joining me online. Oh, Cheryl, it looks like you're talking, but you are muted.
Yes, it always is better to unmute. People can hear you a lot better. So anyway, Sydney, thank you. I mean, this was a wonderful tutorial about mental health, which I think is helpful to all of us. So it was more than just an explanation of your very helpful agency and organization and services that you provide, but learning more about mental health was really important. So thank you so much. That was
Yeah,
excellent. And thank you for providing your contact information as well. So that'll be very helpful.
absolutely. Please feel free to reach out if anyone has any specific questions about something going on in your life. I'm happy to talk.
Okay. Well, just remind everybody that next week, same time, same place here, our guest will be Joan Brown, who is going to share information about the Stephen Ministry, which is a nonprofit Christian organization. And you'll learn more about that. So you can check out what it says in the community update as to what Joan will be talking about. But if you're interested, be sure and tune in. And meanwhile, please stay warm and dry. And we'll see you next week at this time and same place. So